The rapidly spreading Ebola outbreak continues to spark fear, with suspected Ebola cases continuing to rise. As of now, the official number is more than 900 to 1,000 and over 220 suspected deaths are recorded. The WHO chief has called for immediate ceasefire in the eastern part of Democratic Republic of Congo, where a critical aid shortage persists. The suspected infections and deaths have been reported across 3 eastern Congo provinces, including North and South Kivu. Well, these are areas where armed groups continue to hinder access for health workers. The authorities struggle to contain a growing outbreak in eastern Congo. Meanwhile, the WHO chief has called for immediate ceasefire in the Eastern Democratic Republic of Congo to help tackle the Ebola outbreak there. According to the WHO, the deadly Ebola outbreak currently has a case fatality rate under 25%. Well, this is much lower than in other recent outbreaks since it was declared in the DRC in mid-May. The WHO has said states neighboring the DR Congo are at great danger from Ebola and should act immediately to counter the deadly virus. With the growing panic in the area, Uganda closed its border in an attempt to curb the spread. The measure, which also goes against WHO guidance, underscored growing fears of contagious in the Eastern African country. But it has been taken to contain the situation to become like that of Congo. Meanwhile, the United States say preventing Ebola from reaching American soil is now a top priority as the outbreak in Central Africa continues to worsen. U.S. Secretary of State Marco Rubio said Washington cannot and will not allow Ebola cases to enter the country.
Something else that I know is concerning people, because it's on the news, is Ebola. Our number one obligation, we're involved in foreign policy, but even our foreign policy, the number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States.
As concerns grow, the United States is now also discussing plans with Kenya to set up a quarantine facility for Americans exposed to Ebola in Congo. However, Kenyan authorities have not yet approved the proposal. The move comes after an American medical missionary working in Congo tested positive for Ebola and was flown to Germany for treatment along with several others who were exposed.
Why do Americans think that their lives are so much important than the lives of Kenyans? So that they establish a facility in Kenya that is meant for only Americans. If they must be allowed to open that facility here, then it must be a facility that serves every human being in Kenya, Kenyans and Americans alike, but not restricted to quarantining only Americans.
Regional governments are also stepping up surveillance to prevent the virus from spreading across borders. The outbreak remains difficult to contain due to delayed detection, insecurity in eastern Congo and the absence of an approved vaccine for the Bundibugyo strain of the virus. But the Gujarat Health Minister has also confirmed a man from Congo and 3 others in contact with him have been isolated in Ahmedabad.